This is the Humarian Health Podcast.
Spilling our guts for the well-being of yours. So here we are today again at the Humarian Health Podcast, and we are going to be talking about C-sections and breastfeeding as it pertains to the gut flora of babies.
I can't claim to be an expert in these things.
We know this, and that's why later on we're going to bring Dr. Bentley on, and he's going to gut check.
The expert.
Right,
the expert.
for us.
C-sections.
Yeah.
C-sections.
And actually, the reason that we're doing this topic now is because he brought it up in our first set of sessions when we were doing recording, and we learned so much from him about how all of that happens.
Yeah.
The whole like baby gut flora thing.
How it forms.
That we thought that it was sort of interesting and probably a very basic, good starting point for
It is.
moms.
Yep. Mostly if you had a
C-section.
That's right.
Well, and or if you breastfeed. So we kind of put those two together.
Correct. And I think we should separate them out a little bit because they are just as important. Right.
Yeah.
You got some that have C-sections that breastfeed.
Right.
You get some that
Don't
have vaginal deliveries and don't breastfeed or
Right.
can't breastfeed or for all kinds of reasons. And the one thing we know is every person's so unique.
Exactly.
Baby, mama, the whole thing.
Exactly.
And there's variations of every part of this. And we want to try to do the best we can for clarity, understanding, and benefit for you and your child.
Right. And so we had reached out to our mom community, which if you haven't found our mom community yet, you should do that. We're on Facebook.
We're on Facebook.
among other places.
Yeah.
But yeah, so you should connect
We
with
like
us there.
moms.
We like
Please
moms
join
a
us,
lot because moms
Lots of
actually kind of the CEO
They
of the
run
household,
the
right?
world.
They do.
They do.
I think there's a
Yes.
song about that.
Yeah.
But anyway,
We're going to sing it later.
no, you're not.
You're
but
singing.
So we reached out, and really there's lots of questions about what should I be concerned or thinking about if I'm going to have a C-section. And I will say many of those things we won't cover today, like what happens from an anesthesia perspective, like that. We're really focused on, I think, more what happens during the birthing process. So the difference between if you're able to deliver vaginally, what happens in terms of the baby being getting their immune system and their gut flora populated versus if they're
Right, we're talking about the immune system. That is the key.
Right.
That infant coming into the world having a healthy immune system is one of those key things.
Right.
And unfortunately, natural therapeutics are often ignored after this occurs. So let's say the C-section occurs. How do you then help the baby be protected at this point? Not a whole lot spoken of at that point, right?
Right.
And we're trying to get a little bit more clarity so that, hey, every one of the moms want best leg up, best opportunity for the child. And one thing is preventing ear infections, preventing those infections that occur in the first 1 to 2 years, where amoxicillin and things like that are standard treatment protocols, which many of you listening know that's occurred. In fact, it occurs multiple times.
Right.
Guess what? If we can just do a little pre-planning, learn a little bit more, we can help some children, some moms from going through it. So that's the goal, C-sections.
Right. So some of the questions that we wanted Dr. Bentley to sort of step up and answer is kind of the basics, almost like vaginal birth 101, right? Like what happens in terms of populating the immune system for the baby. And
he is detailed.
He is pretty graphic.
Gives me a little quiz.
Pretty graphic.
Little quiz.
Yeah, so he's going to talk about that. And then what happens differently if you have a C-section baby. And I have heard some discussion about what are just some natural practices that seem to happen just as part of having birth, right? So like medications that are given to moms to be and those sorts of things. And so we kind of like him, So we kind of want him to weigh in and do a little gut check with us on those sorts of things as well.
Agreed.
And so the other side of the coin is, okay, I have had a baby by a C-section, or I know that I'm going to have a baby by a C-section. What does that mean for my baby and their gut health and their immune system? Are there things that I really should actually be worried about or be considering, or it's just another way to have a baby, so it's fine? And so we want him to kind of answer those things, like what are things to be looking out for?
You know what that sounds like to me?
What?
I'll tell you.
Okay.
It sounds like the 1960s, 70s, and 80s fact check. Okay. It makes me remember years ago when they started talking about breast milk, and this is a little bit off breast milk, and talking about, hey, we don't need breast milk. We can make this formula and blah, blah, blah. Now of course, 20, 30 years later, common sense has come true again, which is breast milk makes a massive difference. Well, guess what? You have a C-section. It's not a vaginal birth. There's a purpose and a cause and a result of such things. So more than likely, and Dr. Bentley will be much more detailed, which I appreciate because I don't want to do it, that it makes a difference in the flora and the health of the baby and the development of that immune system. So to have a C-section to pretend that everything's just fine, that is just not the case. And that's what we're going to discuss.
Right. And actually, that was a fabulous transition into breastfeeding and breast milk and formula.
Yes.
Right? Because, I mean, all moms have to make different choices. Some women can't breastfeed. Some choose not to. Some choose to and supplement with formula or whatever. There's lots of different situations. And so we want Dr. Bentley to also talk a little bit about his experience, not breastfeeding, because that would be weird.
That would be weird.
But
unless he has one of those things like in a movie where they,
Anyway,
I've seen
so we want him to talk about that. So this podcast, similarly formatted to what we described kind of in our intro, if you listen to that, if you haven't, I'd recommend it because it tells you a little history of the company and things. But and we do have questions for Dr. Bentley, but he's also going to just sort of story tell for us these basics, these 101 sorts of things that are good things to know.
Right. And I think now authorities have been very clear to say breastfeeding with real breast milk is much healthier for the baby. The longer you can do it, the better it can be within reason. And I'm going to put in something that even our well-known fact checker does not know because he doesn't know because I know that he doesn't know. But it's really interesting. I'm sitting in the Netherlands at a place called Triskalia. And we went over there for a different reason of research and information. But what was very insightful is they wanted to talk to us about breast milk, which I thought, why? But what was interesting is they're having a worldwide problem with producing formulas that are not contaminated. Worldwide. Because animals are exposed to the same types of chemicals as we are exposed to, and they're having a hard time producing formulas that don't have heavy metals in it and other problems such as that. Major problems over in Asia, but also problems here. And what unfortunately has started to happen is, like always, when they can't make it the way that we'd like it to be made, the federal government just starts allowing increased numbers of allowance. And guess who suffers? Potentially the baby, potentially you. So that's one thing the fact checker does not know that I know is going on. And it's a worldwide issue, not epidemic. It's a worldwide issue that they're having a hard time making formulas that are really as healthy as they'd like them to be, simply because of cross-contamination. Small amounts, but we don't know if your baby's the one that's going to have the problem. So there, something new.
I love it.
I came with that.
That's fantastic.
And nobody even told me to say it. And
I didn't even give you an assignment.
That was
now
good.
we have nothing for fact checker to
in my brain, so I didn't have a choice.
So with that, we are going to turn it over for our gut check.
Gut check.
Gut check. And bring on Dr. Bentley.
Ryan Bentley.
Dr. Bentley, it's nice to have you back with us. And I think the discussion is yours. And I guess you could take it anywhere you want to, but just make us understand.
Okay. Thanks again for having me on the show. When it comes to people's understanding of probiotics and vaginal birth and breastfeeding, is that it's always been the assumption that when a baby is born, that is their first exposure. The moment that the amniotic sac is broken, when the quote-unquote water breaks, is when they're no longer in a sterile environment, and now they become colonized with bacteria. And that bacteria can happen as they pass through the vaginal tract with the mother's flora, as well as what's around the anus area as well with the mother. So that bacteria plays a role. And then also when it comes to nursing, oftentimes now, instead of immediately taking the baby and putting them in the nursery, they give chest time. And so time for the child to be with the mother to allow that colonization, lying skin to skin, also creates a bond, a sense of energy and peacefulness with that child, hearing the heartbeat that they were very familiar with. So there's a number of benefits of doing this. But part of it is also the colonization of the skin. But again, it's always been thought that was the only time that they were first exposed. Well, research has recently shown that the meconium, which is the very first stool that the child has a full complement of bacteria in the child, which is very interesting because it's completely different than what we've seen in the past or what we've known in the past. And again, the research in the microbiome is continuing to grow at a rapid rate, since like 2010 on. The Human Microbiome Project is really advance things with regards to the information that we're able to get. So the point I'm making is that there's still information that we don't know. But the majority of what we do know is that we know that a vaginal birth does colonize the baby, but we also know that the baby can have colonization not even being born yet.
Okay, I'm sorry, just asking a little bit more detail.
Okay.
Colonize how? What's happening?
Okay. Let's ignore the fact that I mentioned about the being colonized before the amniotic sac is even broke.
Okay.
So now let's just go with our normal knowledge of what we've got and what the research indicates right now. And that is, as the baby is born, they slide down through the sacrum, through the birth canal, through the pelvic girdle, and out they come. And in there, the mother's vaginal tract has bacteria, and the anus is in close proximity, which is where a lot of bifidobacteria come from.
So this is that probiotic, good bacteria
Good
stuff.
bacteria, bad bacteria. Lactobacillus is one that colonizes the vaginal tract pretty heavily, and then the bifidobacterium is the main probiotic that children have, and that usually colonizes in the large intestine or the colon.
Okay.
So as they pass through this in normal delivery, they get exposed to all these bacteria, and that kind of creates the fingerprint of what their colonization will consist of in their body. Now, it's interesting to note that most mothers prophylactically, the majority are put on an antibiotic for preventative measures.
Really?
Yeah.
I didn't know that.
Yeah, such as ampicillin things.
Now, just before birth or during pregnancy?
Towards the tail end of pregnancy.
Okay.
The biggest thing is to group B strep is something that is an issue, and so they want to make sure that doesn't infect the child, which would be a bad bacteria.
So a preventative measure.
A preventative measure, yes.
However,
they're put on a broad spectrum antibiotic,
wow.
And that broad spectrum antibiotic, there's about 11 of these broad spectrums that we know crosses the blood placenta barrier and gets into the child. So even before they're born, if they are colonizing in there, which what research indicates, and these antibiotics are crossing the placenta, then it can change the child's microflora immediately.
Okay, and microflora sets the stage for a lot of that immune system for that child.
Correct. It absolutely does. And so
Okay.
what they found is that children that are born via cesarean, as opposed to a vaginal birth, have increased risks of asthma, eczema, and different types of allergies.
Autoimmune-based problems.
Not necessarily autoimmune where the body's attacking itself,
Okay.
but immune-related problems.
Okay, gotcha.
So yeah, definitely clarifying there that immune-related problems.
Okay.
So that's
C-section baby, moms should be listening that there may be an action step that needs to be considered.
Absolutely. So children that are born via cesarean should be taking a diverse population of probiotics because their only exposure is the skin. Well, the skin is mainly colonized with staphylococcus, which is a type of bacteria as well. So that can create issues, and low diversity of microflora sets up the stage for infections like MRSA. That's some of the things that we've seen. So it's important for us to make sure that we're getting a diverse population, whether or not the mother does it immediately for the child right after the cesarean. So let's say you're listening and you just had a cesarean, you're like, oh my gosh, I got to put them on a probiotic. The answer is yes, I would highly recommend that. However, if it's been 5 years since you had the cesarean and the child's never been on a probiotic, I would say absolutely, because we need to create that diverse population. And it may, over time, just because of the food that they're eating and the environment that they're in, they may be getting more exposed. But we live in an environment where people are using all these antibacterial, cidal type hand washes and really creating this sterile environment that we're losing that diversity that we had that allowed our immune system to function at its best.
So if I'm not a mother. Anyhow, if there's a mother listening and it's 2 weeks past C-section, 3 weeks, they're coming up on a C-section, it almost sounds as though you're saying strongly consider a probiotic, period, just because common sense suggests that. Am I correct?
Yes, and even with that, it's mothers that aren't able to breastfeed, or you've adopted a child. For whatever reason, you're not breastfeeding. Because there are certain immunoglobulins and immune-stimulating boosts that you get from breast milk. And again, also the flora from the skin also helps the colonization process. So even those children that are not breastfed, they would need to be on a probiotic, in my opinion, as well. And as we're talking about the needs of children that are born prematurely, because prophylactically, and premature babies are children that are born, before 33 weeks of gestation. So when they are born, they're typically put on loads of aggressive antibiotic therapy for prevention of certain infections. And in doing so, again, it messes with the diversity that we have of the microbiome in those children, and it sets them up for necrotizing enterocolitis, which is a very bad condition that children get. Overall mortality is increased in these children. So we need to be careful. While antibiotics save lives, there's no question, the overutilization of them can have damaging effects down the line, even to the point of 5, 8-year-olds that are having severe allergies to foods, asthma, those types of things. We need to take a look at, well, where's the majority of the immune system? It's in the gut. And if the gut has been disrupted somewhere along the line, via they were born cesarean, or they were breastfed, or they were not breastfed, there's some type of imbalance, or they were given loads of antibiotics for ear infections, which 90% of those are viral infections anyway, so the antibiotic doesn't do anything. However, they do recommend giving it, and the reason is not that they're trying to do harm to your child. It's just that these viral infections oftentimes, especially in young infants, can turn into a bacterial infection. And these children, as they are growing and developing, it's important that they're able to hear properly so their speech development can occur properly. Sure. And so if they can't hear properly, that's going to create issues, and that's why they're prophylactically giving antibiotic for a viral infection in the ear to prevent such issues, because you don't know who is going to turn into a bacterial infection or not.
So I'm sitting there thinking there are several cutouts, because I know one thing. As soon as I got out of school, I saw my first patient and figured out they're not in the book. Nobody's exactly the same. So you covered some key factors that really need to be covered and just highlighted. And correct me if I'm wrong, because I do that a lot. Antibiotics, while pregnant, can and many times changes the baby's GI tract's probiotic level or quality of it, and should be considered. That's one.
Correct.
Okay, number one. Number two, C-section kind of goes without saying, because they're just not going to get that exposure. That's something that should be considered.
Correct.
Okay, breastfeeding, whether vaginal or C-section. If you can't breastfeed, you might want to consider this. Or is it also if you're only 2 weeks or 3 months or something like that? Is there kind of like, hey, about 3 months, if we get that much breastfeeding, it's pretty good?
Restate that last question.
Well, because there's always one mother could do it 2 weeks, one could do it 2 months, one's done it 2 years. Is there a period of time that I think Lalechi says like 9 months or something like that.
If I breastfeed for 3 months, is my baby's like gut flora as diverse as it's going to be? And then if I for some reason can't, or I'm going back to work and I decide not to, or whatever,
2 to 3 months, right?
Then they really don't need a probiotic, because the 3 months of breastfeeding is sufficient? Or is there a time limit to supplementing my baby with a probiotic?
No, that's a great question, and that's something that I have not read anything in the literature currently with regards to that specific question. Things that I do know is that it indicates that after about a year, you've lost pretty much all the benefit that you're going to get from breastfeeding.
From the autoimmune part, I know there's bonding and all that stuff, but
correct, from an immunological standpoint.
Gotcha.
Absolutely.
Okay. All right. So key pregnancy. First of all, worst thing to do is get in the way of mama and her kid. They're always trying to do the best. Mm-hmm. And I'm wondering how many programs, honestly, that some of your mama friends, Amy, have actually been able to delineate when they should be concerned about it or not. I know midwives, they're on this stuff pretty consistently. But I'm just wondering from our listeners if, in fact, it's common for them to actually hear this. If they were a C-section, where they said, hey, consider a probiotic. It would be interesting to get feedback on that.
Yeah, actually, it would be interesting to get feedback. We talk a lot in the mama groups about lots of different things, and especially to bring information to this podcast so that we're relevant. Mm-hmm. We've not really, I think, scratched the surface on the concerns and questions around C-sections and breastfeeding, and I mean they're sensitive topics to start with for a little bit, but also just relative to probiotics as well. I mean, there's some new things that I've heard today about even as a mama taking a probiotic while pregnant, and why there would be instances where that would be a good idea, right? And then now talking about on the baby side after the baby's actually here. And so that's an interesting, I think, perspective as well. So
thank you, Dr. Bentley. I mean, very insightful, new information. Going to be great. We'll percolate this through, and we'll see what the response is.
Amy Baker, Dr. Sean Benzinger.
Humarian Health Podcast.
Spilling our guts.
For the well-being of yours.
That's right.
Thanks for having the guts to listen to the Humarian Health Podcast. Make sure you follow us on social media. We're on Facebook, Instagram, and Twitter at Humarian Health. If you have things you'd like to gut check, send us an email at gutcheck@humarian.com.